When I think of participants in our CATCH cohort, RA has changed a lot with respect to treatment. I always say when I'm enrolling a patient, what I learned from you and the other patients in the CATCH cohort makes me a better doctor. Why? We have a faster time to remission. We can look at predictors of remission, predictors of who needs an advanced therapy. And with that knowledge, it enables me to use the toolkit I have as successfully as possible. So if I think of the CATCH patients in our whole cohort, more than 3,200 patients now, they have taught me a lot about rheumatoid arthritis. We've learned that flares from a patient perspective have to be quite high flares before they'll actually seek medical attention, and that 50% of the time we're not even concordant with flares unless if they're quite serious disease activity of RA. I've learned that if you're in remission at 3 months, the chance of being in remission at a year obviously is far higher. So early remission equals sustained remission, and deep remission, zero swollen joints and/or MD global assessment of disease activity of 0 to 10 is strongly predictive of doing well down the road. We've learned that if you have higher BMI, if you smoke, so lifestyle issues, less chance of going into remission. We've also learned that if we look at patients who are rheumatoid factor or anti-CCP, ACPA positive, that they have a different prognosis than patients who are negative. And the prognosis can go different ways. The seronegative patients start with higher disease activity, and some of them will go into lower disease activity than the seropositive. But seropositive patients have longer disease duration. And so the shorter your window of symptoms to first getting treatment, the more chance of remission.